You also need a certain level of detachment from your product as well. If you're too in love with your product or your solution, it's going to be very difficult for you to, one, receive feedback, but two, also to be able to pivot and make changes to your product so that you can ultimately drive greater uptake and success in the marketplace.
Welcome to Startup Health Now, the podcast where we celebrate the entrepreneurs and innovators reimagining the future of health. I'm your host, Logan Plaster. In health innovation, you can have the most amazing idea and a rock-solid business plan, but in order to scale, you might still have to collaborate with the right enterprise partner. Topping this list for many entrepreneurs is Anthem, which serves 40 million people and is ranked 57th on the Fortune 500. It's safe to say that if you are a startup and you can get distribution through a network like this, it's going to put you on a whole new trajectory. In order to find out how Anthem works with startups, we invited in Omid Toloui, Anthem's Vice President of Innovation. Anthem has had a range of programs in recent years aimed at collaborating with nimble, forward-thinking startups like their Innovation Studio in Atlanta and their Digital Incubator Program. But we wanted Omid to pull back the curtain on exactly how Anthem thinks about innovation and then talk about how startups can partner with them. This episode was excerpted from a fireside chat held in front of a live audience of founders from the Startup Health portfolio. Enjoy. Omid, let's start big picture. You run a whole innovation team, a whole division there at Anthem that looks for promising startups and helps them come to market and grow utilizing Anthem's various very large pools of patients and consumers. So just start by telling us how that innovation ecosystem works within the organization and, more specifically, how you partner with startups.
Yeah, for sure. There's a mantra that I learned when I was standing up a product management division at a previous role that I had. And I went through this training with a company called Pragmatic Product Management, which I'm sure some of you have heard of. And the mantra was, your opinion, although interesting, is irrelevant. Your opinion, although interesting, is irrelevant. And to me, this is something that I think we all need to adopt in the healthcare marketplace. And I think it's really central to kind of our ethos as an innovation team within Anthem. I think all too often within the innovation space, innovation teams suffer from, and organizations suffer from what I call shiny hammer syndrome, which is the teams, organizations are quick to fall in love with the shiny object, the shiny new solution, and then they turn to the business, looking for the nails, right? And in the process, you end up hitting a lot of thumbs and pissing off a lot of people and creating a lot of frustration. And what we've done as part of our team is our operating model flips that on its head. So we really start by understanding what the nails are. What are the challenges that our business units are having? What are the corporate priorities? What is the data telling us in terms of where we have the greatest opportunities to innovate and where we have the greatest opportunities for impact? And then from there, we apply our human-centered design. We have a dedicated human-centered design team that goes deep on the problem. They understand it from the various components. They understand it from the perspective of the member, the provider, the various stakeholders that we have, the business units. And we emerge from that process with a much better understanding of what an idealized solution could look like. Now, sometimes that idealized solution is kind of what our opinion said it was going to be, and it's validating, right? But that's more often than not, it's a derivative, it's some aspect of that, or it's something completely different, or there's certain insights that we uncover that are kind of change our point of view or our perspective. And what that process helps us do is it helps inform like what an idealized solution is going to look like. And then from there, we have to make a decision. Is this something that we should build in-house? Is this something that we should partner with, a vendor or an established company or a researcher to procure? Or should we go out into the marketplace and identify, an early stage startup that can help us, gain this capability? And then I think, the other piece where I think a lot of innovation dies is like post-pilot. So, the next phase is pilot. And I think a lot of companies are really good at doing pilots. Certainly we are. and studying them to see if there's impact. But I think a lot of the times where, I've seen challenges in the industry and in my own work is post-pilot. What then? So you've identified value. How do you then go and extract, that value across the enterprise or across an organization as large as Anthem? So, we focus a lot, and we have a dedicated team that's focused on, taking the innovations and the value that we found and expanding that across the enterprise. So these are what I like to call my innovation bulldozers. So they bulldoze the path to scale, because at the end of the day, innovation is really only truly innovative if it leads to impact at scale. If we're just doing pilots and patting ourselves on the back, we're doing experiments. We're not really doing innovation. Innovation is when you can take the value that you've identified in a pilot and then expand that so the broadest set of consumers can take advantage of those innovations. And so we're very much focused on driving things through from pilot and through to scale. So through from seed to scale.
Got it. Let's get a little more specific about some of those drivers and some of those areas of focus. You said that the antidote to the shiny hammer syndrome, which I like because it combines the shiny object idea with everything's a hammer. If you have a hammer, everything's a nail. So two great images pushed together. The antidote to that is really to understand the true problems that an organization has. So let's talk about what those are, because those are the kinds of problems that the founders on this call might be trying to solve.
I think the wonderful thing about the healthcare industry is that there's never a shortage of, problems to solve. And I think the challenge that we all face is the discipline that we need to be very focused on the problems that really need solving the most. I could go into kind of a laundry list of things that we're focused on, and certainly, we try to make sure that the work that we're doing is very much driven by the needs of the business units, by what the data is telling us, right, and what our strategic priorities are as an organization. Some of the things that are kind of top of mind for me, and maybe this is just a virtue of the fact that I've been talking about this recently with my teams, is that I think too often in healthcare we look at problems kind of in a very kind of like an individualistic point of view, or we think about members or individuals or consumers or patients, whatever term you want to use, as defined by the illnesses that they have, or a compendium of the illnesses. And I think that the opportunity that we have is to think more about members or consumers from a whole health perspective, really looking at them holistically from a behavioral, social, and physical point of view. And I think within each one of those buckets, there's a lot of room for innovation. There's a lot of room for advancement. So when we think about behavioral health, we've seen the burgeoning of digital behavioral health solutions over the last 3 years, especially kind of catalyzed by the pandemic and the tremendous need for digital BH and virtual BH. But what we're not seeing is solutions that are helping members identify what the right behavioral health intervention or solution is for them, right? That level of customization. And we can be doing more to be predictive and proactive in identifying behavioral health needs and getting folks connected to the right services and solutions for them. We're also seeing a tremendous rise in adolescent behavioral health issues. We're seeing a rise that's in depression and anxiety within the adolescent space that's 2 times as great as what we're seeing in the adult space. On the social, side, I think we still have work to do as an industry in closing a lot of and addressing a lot of the gaps as it relates to health equity. Areas that we're focused on are helping folks with transportation, getting to the care they need. We're seeing a lot of need to bridge the digital divide. So all of us, on this call are probably digital natives. Throughout the entire pandemic, we've had smartphones and access to high-speed connectivity. And as the virtual and digital solutions in the world have grown, we've been able to benefit from that, right? Because we have access to internet, we have access to smartphones that let us participate in this new reality that we have. But sadly, that hasn't been the case for a lot of folks that don't have access to smartphones or adequate internet connectivity. That's an area that we're focused on addressing as well. And then on the physical, side of care, we see a lot of care moving into the home. And obviously, we've seen a lot of that as a result of, the pandemic. We were forced to be at home. And I think we've seen, and we're seeing more and more models of care and chronic disease management being done at home. And so we see a lot of that moving into the home, not only for, folks that have chronic conditions, but folks that, are elderly, that want to age in place, that want to receive more of their care in the place that's the most comfortable to them, which is their home.
I saw a video that you posted recently about how Anthem is sort of shifting their mindset from being a health insurance company to what I think the video is called a lifetime health partner. And I find it interesting. That's really in line with what you just described and sort of the type of innovation that you're looking for. And also, it's probably worth mentioning that's also seems to be part of the ethos of the Anthem name change. I don't know if you have any sort of color commentary you can give us about the announcement in March that Anthem intended to change its name to Elevance Health, and if that has something to do with this changing perspective.
Well, really excited about the name change, and hope our shareholders will approve it. I think you're right. I think this idea of being a lifetime trusted partner in health is a big part of what drives us as a company. When you think about it, your health plan has every incentive to make sure that you're healthy, that you're getting the care that you need. They also have the ability to see things end to end, right? Where when you go to the doctor, your doctor has the EMR, they understand, one aspect of your care, but but we have the ability kind of from our perspective to see all the care that you're receiving, to then take all that data, leverage it, to draw insights, and to find the right types of solutions, both in person, virtual, digital, that can ultimately benefit you and your health, and make sure that you're able to live a happy and healthy life.
Let's get really specific about how you actually work with startups. We've got dozens and dozens of startups on this call. And they might really have no idea kind of what Anthem's innovation ecosystem is like, how you run pilots, how you talk to startups, how you work them into your system. So let's get tactical about it.
Yeah, for sure. So innovation is a team sport. We can't do it alone, and so we oftentimes partner with innovative startups and companies such as yourself. I think working with a health plan for a lot of startups, especially early stage startups, can be somewhat daunting. They maybe have never worked with a payer, they haven't had a payer contract, they don't know what the process is like, just even the basic fundamentals of it, like what does it take to get a contract, what are the security approvals that you have to go through, what are the legal approvals that you have to go through. So part of what we can do in order to, as an innovation team, is just to make that process as easy as possible for the companies that we're working with. But to go back to my earlier comments, what really matters to us the most is whether that startup that we're working with, one is solving the problems that we've identified, the true needs that we have, right? And whether they have the capability to scale. Because I think that is one thing that you mentioned at the beginning. We have over 40 million members, about 45 million members. That's 1 in 8 Americans across more than 14 states. So when you're working with a company of that size and scale, you need to have what it takes to scale. And our jobs as an innovation team is one to help not only identify companies that are solving kind of some of our needs, but to have the ability to do that scale. And if they don't, provide them with the feedback they need in order to get, to plug those gaps and be able to come back and work with us in the future.
Omid, let's go in on that a little bit deeper, because there's probably folks on the call who are thinking, love to work with Anthem, wondering whether I have the ability to scale the way he's describing. And we've talked to folks from Walmart and we've talked to folks from CVS with similar language. You got to be ready to scale. And it's a bit of an unknown if you're an early stage company and you're like, well, what does that mean? So what are the marks that you're looking for in a particularly early stage company that hasn't done it before? that tells you that you can have confidence?
Yeah, that's a really great question. I think there's a few different ways I can answer that. I think the first is like honesty. I think that just being honest about what your capabilities are,
I love
and
it.
like whether or not you have certain concerns. If we're working with a startup, there's clearly interest that we have in that company. I think at that point it just makes sense to be open and honest about what your capabilities are and maybe some of the challenges that you may have. Oftentimes we'll work with a company, and we realize the fact that they're early stage. We don't expect you to have everything figured out, right? I think part of the some of the value that we provide as an innovation team through either our Anthem Digital Incubator Program or our fast track to scale accelerator is some of the hand holding that's needed to scale within Anthem. So we try to do as much diligence up front, before we enter into a relationship to make sure that the company has what it takes to work and be successful within Anthem. And then, through a small scale pilot, we then validate that. And I think it's during that pilot that we really see whether or not they have what it takes. And if they don't, and we think that there's value, we try to keep that relationship strong, and we try to provide as much feedback and sometimes even investment to help get them to where they need to be. And then to invite them back, once they're ready to then start scaling with us.
Omid, you said a minute ago that company that you work with has to have the ability to scale, but there's certain things that you can sort of hold their hand on. And I think there's the devil's in the details. What are the things that you got to have, and what are the things that you can grow into? And something I like to ask guests is for sort of non-intuitive wisdom around that, because I'm guessing people come in and they think that they have it nailed, kind of what they need, what's table stakes and what they can grow into. And yet there are probably some common misunderstandings that folks have. So I wonder if there's any trends that you've seen, maybe folks putting their emphasis too much in the wrong area and you realizing like, no, this is a place where we can help you grow versus you got to come with this already set. Is there sort of non-intuitive wisdom there?
Yeah, I think that's a great question. I think one is like just assumptions. Like, are you making the right assumptions? What are your assumptions based off of? A lot of times those assumptions are driving the model, the clinical model, this various aspects of the solution. And oftentimes, they're making those assumptions because they don't have access to data, or they don't have access to a patient population as large as ours. So I think being, again, the whole idea of honesty, just being upfront about the assumptions that you're making and whether they're accurate or inaccurate. I think also just data security is really important to us. So we take the privacy and security of our members' data like incredibly seriously.
Yeah.
And I think that oftentimes is an area where companies that are smaller or earlier stage get tripped up because there are certain standards that you have to meet. And so I think doing a little bit of prep and research on what those things are, I think is certainly helpful. And we walk through that process with the companies that we work with. And oftentimes it's it can be a painful process. Sometimes we try to not to make it as painful as possible. But there are certain standards that need to be met in order to work within Anthem.
Something we talk about so much at Startup Health is just the role of the founder mindset and how you think being as important as really kind of what you're building. And I wonder if you could speak to the mindset of the founders that you're looking to invest in at Anthem.
I think people often ask, like, what do you look for folks that are joining the innovation team? And I think that it's oftentimes the same answer I'd give to a question about like, what do you look for in a founder? And I think that's a high level of grit. I think the thing you need to be successful, I think, in the healthcare system, and Jamie's on the line, very successful entrepreneur, is grit. You have to have determination. You have to have tenacity. You can't give up because there are going to be a lot of roadblocks and obstacles that are thrown your way. But you have to, stay focused on the impact that you're trying to generate, and those lives that you're trying to improve. I think that's number one. I think number two is also, again, it comes back to a certain level of honesty and humility with yourself. and with your product. I think that there's a lot of confidence that you can show in being open and honest about, where the gaps are in your product and how you can work with a partner to fill those gaps. I think that's something that we look for as well. And I think, you also need a certain level of detachment from your product as well. If you're too in love with your product or your solution, it's going to be very difficult for you to, one, receive feedback, but two, also to be able to pivot and make changes to your product so that you can ultimately, drive greater uptake and success in the marketplace. And so I'd say those are probably the top three things that I look for.
I love that last note because that kind of goes along with that counterintuitive wisdom idea that I mentioned before. The willingness to be a bit detached makes me think of Stephen King's writing tip of being willing to kill your darlings. You have to be willing to extract yourself from the situation.
Yeah, another way of saying is that you got to be able to call your baby ugly.
Parting piece of advice for a founder navigating the healthcare landscape today. What's your last word?
The insight is, just to remember the impact that you're trying to generate. Like every day when you wake up and you go to work, like think about the lives that you're trying to change, the impact that ultimately your work is going to lead to. Because I think that so often we get tied up in the day-to-day, right? There's a lot of stuff that we have to deal with, like you're fundraising one day, the next day you're trying to, secure a deal, the next day you're trying to apply to get into an amazing program like Startup Health. There's so much, practical stuff that we get tied up in. So just at the end of the day, at the beginning of every day, focus on, what the end goal. That's certainly what I do. And that should help you, get through the challenges of working with, of navigating the healthcare system and trying to, achieve scale.
Beautiful. Well, Omid, I echo all the thanks that are coming in on the chat right now and say thank you so much for taking the time with us today. We know you're busy as well.
Thanks for the opportunity.
Take care, everybody.
Thanks for listening to Startup Health Now. Startup Health invests in health transformers from around the world who are committed to achieving audacious health moonshots. If you want to learn how you can join this community of entrepreneurs, or if you want to connect with one of our 380 companies, go to startuphealth.com. If you'd like to learn how you can invest in our Health Moonshot Impact Fund in collaboration with AngelList, go to healthmoonshots.com. Thanks for listening to Startup Health Now. We'll be back next week.